Oh, hey.
Hey, how are you?
Good, good.
Are you ready for your 52 questions?
Yeah, of course. I'm excited for this.
Yes. All right. So first question, the easiest one. What is your name?
So my name is Dr. Thomas Nguyen. I'm a periodontist.
Oh, you already skipped to the second question. I wanted to I wanted to ask you what's your specialty? So a periodontist. And how many years have you been practicing?
So I've been a dentist since 2010, but I've been a periodontist since 2016. So it's been 6 years now.
Oh wow, almost the 10-year mark. So where did you go to dental school?
So I come from a family with a lot of healthcare providers, and it seems like a right fit for me. I really enjoy helping people. I enjoy the research side of dentistry
Mm-hmm.
and all the technologies and all the things that we can use in dentistry.
Okay. And which school did you go to for dental school?
So I went to University of Montreal for dental school. I did my whole education in French,
Okay.
and it's only after that I started to speak English.
Oh, wow, really? So, and where did you do your residency?
So why don't we go to my office
For
to
sure.
keep on the interview?
Yeah.
So I did my residency after dental school at the University of Rochester
Okay.
in upstate New York.
Yeah.
And after that, I worked for 2 years as a general dentist.
Mm-hmm.
And then I decided to specialize in perio afterwards.
Okay.
So I went to the University of Minnesota for my perio residency.
Got it, got it. So, what did you like about dental school?
The thing that I miss the most about dental school is all the friends that you have. You hang out with people the whole day. All you think about is studying, and then after that, you go out to eat.
For sure.
So it's that camaraderie that I really miss. Now, once you graduate, you won't see your friends anymore.
Mm-hmm.
Only during like meetings or something like that.
Okay. And what did you dislike about dental school?
You know, being now a professor at a dental school, I kind of see it clearer now. It's very difficult to run a school,
Mm-hmm.
and there's a lot of issues you have to deal with.
Right.
But when I was a student, I think what I didn't like is how unorganized it is and how all the faculty are giving you different answers.
Yeah.
Nothing was really clear, but now I can understand that this is how the school runs, and you kind of have to adapt to it.
And how did you handle stress as a dental student?
Um, you have to take it not too easy, but you have to have time for yourself, time to do things that you enjoy, spend time with family and friends, and this is what really helped me through dental school.
Okay, okay. And did you always wanted to become a dentist?
Actually, I never really had a plan. Like I said, I knew that I wanted to do something in healthcare, and I kind of discovered dentistry and somehow fell in love with it. And I never planned to become a periodontist either. And somehow it just seemed like the perfect fit.
Mm.
And then finally, I never planned on becoming a professor, but I really enjoy what I'm doing.
That's good, that's good. Was there a specialty that you thought that you were going to go into when you got into dental school?
For sure, not perio. I wasn't a big fan of
Really?
periodontics. I was never interested in specializing, to be honest.
Mm-hmm.
I just wanted to be a dentist. And then, I saw my friends doing residencies, so I applied for residency. And then it was during my AGD residency that I was placing implants, doing a lot of surgeries. And this is how I started to be interested in perio.
Got it. And since you didn't, was there any specialty that you were like, no, this is definitely not for me at all?
Back in the days, or
Yeah,
now?
back in the days.
Back in the days, perio was one of those specialties.
Really?
I was like, no, I don't like to do cleaning all day. This is not something for me.
Mm-hmm.
But other specialty than this, I think endo would be one. I wasn't particularly interested in endodontics.
Okay.
But I kind of enjoyed everything. I enjoyed being a dentist. I enjoyed doing crowns. I enjoyed, everything about dentistry, except that I just love perio more.
Got it, got it. And so back in residency years, what did you do to prepare before applying to residency?
Um, I mean, I've been through that process many times. Um, maybe just remove my mask if that's okay with you.
For sure.
So I think the most important thing is spend a lot of time on your letter of intent. Um, Start early for getting your letter of reference, because some of the students here asked me like a week before, and I'm like, sorry, I can't really help you with this. It takes time to write a good letter. So the best advice I can give is to start early. The earlier you can, the better. Normally, if you're applying to GPR residencies, maybe start around the beginning of summer, like June. If you're applying to specialty, then you have to start maybe April, because the deadline, some of them are June 1st.
Mm-hmm.
And it would be very sad if you miss the deadline and you
For
cannot
sure.
apply.
Yeah. So the moral of the story is to start early.
Absolutely.
So what did you wish that you knew before going to residency?
That's a very good question. I guess in my head, residency would be the same thing as dental school, but like a step up. Meaning, people will be over your shoulder. They will like tell you what to do. They will hold your hands to do things. But it's not this. You have to be independent. You're already a dentist. You're seeing your own patients. You only ask for help when you need to. And a lot of the teaching and learning is independent. So you have to read articles and try to gain knowledge from those. You have to have your critical thinking. So it was very different from what I had in mind.
For sure, for sure. And did you start residency right after dental school?
No, like what I said, I didn't know what I wanted to do. It took me some time to discover what I really enjoyed. And I think this is an important step for everyone considering a specialty, because this is what you will do for the rest of your life.
Mm-hmm.
So don't go just because your friends are doing it, or maybe you want to be a specialist. You really have to get into a program or a specialty that you enjoy and that you know what you get into. Um, so yeah.
Yeah. And what was the hardest part about residency for you?
The hardest part about residency must be that everything is very intense for 3 years. We have to read like 30 articles per week. We have like
Wow.
patients all day, and then we have exams and courses, and then sometimes you're on call, and you don't sleep the whole night,
Yeah.
and then you still have to go see your patients and go to class. The other thing too is you can't sleep in class because you're only 3 per year. So those are very small groups, and you can't really hide from that.
For sure. Oh my god, that sounds so hectic. So what was on the other side? What was your favorite part about residency?
I think the same thing. The same thing that I thought was difficult, meaning that you have to be more independent. I actually really enjoy it, not having to like get everything approved every 2 seconds or wait for people. I really enjoyed the learning. You learn so much. It's very intense in those 3 years. I got to do like a lot of things that I never thought would be possible. When you go from dental school into a specialty, you still feel like a dental student, but suddenly you start placing implants, you're starting to do bone graft, you start doing like sinus elevations. So those are all like very exciting and at the same time scary procedures.
So now, putting your thinking cap and more marketing cap on, why should someone choose your specialty?
I mean, what is it not to love about Perio? It's one of the most diverse specialty. If you think about other specialties, sometimes you just do one type of procedures. In Perio we do treatment of periodontal disease, gum grafting, aesthetic cases, a lot of implantology, a lot of bone regeneration. It's one of the specialty which the richest body of research. Let me just close the door for a second.
For sure.
Um, and it's also the specialty that works the best with everyone else. So perio pros work well together, perio ortho, perio endo. So I think overall, there's a lot of opportunities. It's never boring. It's always different. There's so much new products and technology coming out. And also, perio has a huge impact on the rest of your body too. So there's a lot of link between coronary disease and periodontal disease, diabetes and periodontal disease, even Alzheimer's disease and periodontal disease.
Good. And then now, for a devil's advocate, why should someone not choose your specialty?
Okay. I mean, someone shouldn't go into perio if the only thing you want is to do surgery. Because at the end of the day, perio still is, cleaning and management of initial therapy. It's not only a surgical specialty. So I think a lot of people have like, oh, they say, I love implants, I want to do implants, and then they go into perio. And this is how they get hit the hardest because the first year, you won't do so much of implant and you'll do a lot of, scaling and root planning, periodontal surgeries, like open flap debridement, crown lengthening, and those things. And they can sometimes feel like they're wasting their time. But, implantology is just one part of perio, but it's not everything. I think periodontists are still the best to manage placing implants because we look at soft tissue, we look at bone, and those have very long-term impact on the survival of your implant. But it's not the only thing. So this is what you have to be careful.
Got it. So now let's just talk more about you. What does an average day look like for you?
I mean, my days are never average or the same. For those who don't know, I spend my time between teaching at McGill University, seeing patients in practice, and also lecturing and doing research and administrative work. I really love what I do just because of the mix. Anytime that I'm tired, teaching, I get to do something else.
Right.
Anytime I get tired of seeing patients, and I go back to teaching. So a typical day or a typical week would be, teaching, seeing patients, and on the weekends, like lecturing and traveling.
So very flexible, I guess. And what do you look forward to the most when you come into work? So whether it's private practice, school, or teaching?
I mean, the good thing with when you have a well balanced schedule and you don't do the same thing every day is you actually look forward to the tasks that you have to do when you come. Like any day that I have to come and see patients, I'm super excited to do those procedures and treat patients. And then when I'm tired of that, I'm excited to go back to school and then interact with students. Um, and I like the creative side of dentistry and of research, all the innovation. So it keeps me busy, and that's why I really like it.
That's good. And then now, what is your favorite thing to do when you're not working?
I don't know when I'm not working, but I enjoy seeing friends, going out to eat. I'm a big foodie. I know everyone is a foodie, but I particularly enjoy food. I like to play tennis, play golf with some friends.
And how many hours do you work usually per week or per day?
I think it's very hard to calculate. Like I said, especially in academia, your day doesn't end at the end of the day after 5 o'clock. You have corrections to do. You have to prepare presentations. You have to answer emails. I'm also in charge of organizing research day and a bunch of other courses. I can't really give you a number. Maybe 80 hours in a week.
Oh, so busy. So on the days that you go to clinic, how many patients do you see on average?
I think it depends on if you do big surgeries or not. Sometimes you can do one big surgery and it takes 3 hours. Other times you have like smaller treatments. So I think the average would be between, 15 to 20 patients a day.
Wow, that's a lot.
It's a lot from 1 to 2.
For sure. So another question would be, what's your favorite procedure to do as a perio?
I really enjoy regeneration. I think there's something that very clinical about it. It takes clinical skills. It takes a lot of precisions in your suturing, in the manipulation, but also on the other hand, it's very intellectual, like using growth factors, using different types of biomaterials. So it really marries well research and clinic for me, and this is what I enjoy the most.
That's good. That's good. And then now, what is the most difficult case that you've had to face?
This is a very good question. Um, I mean, I receive a lot of difficult cases because being a specialist, you're like the last point of help, and everybody refer to you.
For sure.
But that being said, I think the most difficult cases are actually patient management. There are some sad story where patients in their 50s still have money, they want to have good dentition, they go to a dentist, they have all their teeth extracted, they spend like $40,000-$50,000 to have implants in their mouth.
Oh, wow.
And then by the time they're 60s, those implants are failing. And there's technically nothing you can do for them because there's no other options after this. And also they don't have money anymore because they're retired, they spend most of their money already. So those are very difficult cases, and you kind of have to be there and compromise and try to help the patient the most that you can.
For sure, for sure. So now let's talk about on the more brighter side. What's the most impactful patient story that you have?
I mean, it should be the same also, patients with a lot of problem that you manage to help them. Some patients come to see me and they never had a cavity in their whole life, and they think they don't need to see the dentist. But periodontal disease, even if you don't have cavities, you can still have periodontal disease. And by the time they're 50s, they lost all their bones and their teeth are mobile, and you can't really save them anymore. I think one of the stories I remember is a very young patient. She was 10 years old, and she had like Papillon-Lefebvre syndrome. Those have extremely severe bone loss at a very early age. Um, and I remember she was just sitting there crying, and she didn't want to have dentures because, at 10 years old, this is something life changing for her. So we really tried to treat her and then keep her teeth as long as possible. And I started treating her in the beginning of my residency. And 3 years later, when I was graduating, she still had her teeth, and she was coming every 3 months for cleaning. And I think she turned 13 back then. So she was more of a teenager. And it was really impactful to see like how we help her maintain her teeth over the years.
Oh, for sure. That's a very good success story. And how long does it usually take for you to chart?
To chart.
Yeah.
So it's a lot faster when you have an assistant. I know that sometimes in clinics it takes you like an hour to chart everything. I think most of my exams are an hour long, but you still have to take X-ray. You have to do a lot of different things and have a diagnosis and treatment plan. So I think 20 minutes would be the time that I take for charting.
Got it, got it. And so what time do you usually wake up?
I love to sleep. I usually wake up around 7:30.
7:30.
Yeah.
And so how many hours do you usually sleep?
I know I just said I love to sleep, but I don't sleep that much because I actually sleep very late. Sometime 1 or 2 in the morning. So between 5 and 6 hours every night.
Got it. So you mentioned previously that you are also a researcher. So what made you want to become a researcher?
This is a very good question. Um, I think everyone is a researcher in their own way. Research is only asking questions. So let's say if you want to buy the best phone, you'll do some type of research, look up information, what people think, and reviews and all this. I think as a researcher, what is exciting is you're looking to answer questions that don't have answers. And then you have to find ways to find an answer and document each steps, and then after that share with everyone. I never really thought I would be a good researcher, but again, I just kind of fell into it, and it keeps my work exciting, working at the cutting edge of technology. So yeah, I think this is why I do research.
Oh, that's cool. That's cool. And then what is the main topic of your research?
So I like I said, new technologies and how we can use them to improve patient care and patient experience. So one of my main research right now is using AI in order to diagnose periodontal disease and order to identify dental implants. I think it is the future. It is a very powerful tool, and it can make our life a lot easier. AI won't really replace dentists or even periodontists, but what it will do is, save us time so we can spend more time with the patient and do what we're good at, and then the rest, AI can help us.
Got it. And what do you think is the toughest part about research?
I think the toughest part about research is finding money. I think this is what most researchers struggle with.
Right.
In order to do research, you need to have money. And in order to have money, you need to have published research. So it's like a it's like a circle.
Yeah.
You kind of have to start somewhere.
Got it. Got it. And what is your proudest publication?
I think one of I guess I have two. One is the RPPG. So we actually created a new technique to treat recession on the palate. So before us, there was only one other publication back in 1991 talking about connective tissue graft, but it didn't work really well, and our technique really improved the situation, and it can have an impact on how everybody treat patients. And this is why I also like research so much. So that one is one of the publication that I really enjoyed. The other one is I was part of the American Academy of Periodontology Best Evidence Consensus paper. So it was a group of experts by the AAP that they put together to look at the effect of gingival phenotype on periodontal health. So that was a great experience and a great paper.
Wow. That's very good.
I'm sure you'll understand it someday when you listen to that interview back.
For sure, for sure. So, what do you hope to achieve in your research in the near future or the far future?
I mean, I think this is a very good question because you need to have vision in order to do significant research. So in the long term, I think I want to have put in place a way to use AI to help you in your practice, either diagnosis of periodontal disease, prediction of treatments. So if you place an implant, there's different factors that influence an implant longevity.
Right.
So by having something that can predict the health of an implant, you can better treatment plan in the future. And this is what we're working towards.
Got it. Got it. So let's just talk more about your past.
Do you know how many more questions we have?
We have a couple more, like a dozen.
Perfect.
So maybe you haven't said this, but you were previously the interim director of predoctoral periodontology at Harvard. So what were your daily activities there? So, like your daily responsibilities?
Yes. As the director of the predoctoral program, you have to make sure that it is running smoothly. So, meaning that you're in charge of the curriculum, looking to, all the information you have to teach students so they can actually pass their boards. Because that's the main goal of any dental school, forming students so they can become dentists.
For sure.
And then having enough faculty to cover the clinic and to give those lectures, managing employees and a budget, and making sure you don't spend all the money. There was a lot of administrative work into it, but it was a very good experience. I was also the predoctoral director right when COVID hit.
Oh wow!
So that was one of the most challenging time of my career. Moving everything from in person into Zoom and making
Right.
sure that students can finish their quota and how to adapt to that situation. But hopefully that year everybody passed and we were all happy that all 35 students graduated.
That's good. That's good. And how does one become a director? Like, do you need to meet certain academic quotas, or like numbers of publications?
I mean, first you have to be in academia. You have to be, a professor, and I think it has to be with timing and luck. Also, in my case, I started at Harvard a year before I became director, so I had time to like settle down, see how everything was working, and then. The previous director kind of left, so there was like a role to fill in. So you kind of have to be there at the right time, be willing to put in the work,
Right.
and some people learn as they go. Other people need more experience. I guess I'm more of a person who would learn as I go and try to adapt to the situation.
Got it, got it. And what did you like about Harvard's dental school as opposed to, well, compared to McGill's or UDM's?
Um, I guess it's a smaller school. It's the smallest school in North America and the world. I think it's very similar to McGill University as they have 35 students, and I think we're 40 students.
Yeah.
They spend more times in learning medicine for the first 2 years before going into dental school, a bit like what you guys are doing. I think the main difference between those three schools would be University of Montreal. It's a bigger school, 90 students per year. They start in dentistry right away. I think there's strong points on both. A bigger school have more budget, has more faculty, you can do more.
Yeah.
But on the other hand, you have also more problems you have to deal with. I felt like when I was at the bigger school, all day was like answering email and putting out fires.
Yeah.
In a smaller school, you kind of have less students to deal with, so less problem. I'm not saying that students are problem, but sometimes they do cause problem. And you can implement things more easier because
For
it's
sure.
a smaller organization. So change comes easier.
That makes sense. That makes sense. So how do you handle work-life balance now as a dentist, doing research, clinic, and also academia?
I think this is a question that everybody struggle with. Even dentists, clinicians, but especially people in academia. It's a very competitive field. A lot of people are consumed by. We're very passionate, so we love what we're doing. So people put all their time into education, put all their time into teaching, and have a bit less time to spend with family. I think that it's something that you have to really force yourself to have like good work life balance. It's like anything else, it's like discipline. So I actually set away time that I would visit my family, spend time not working and doing something else. I think that the fact that my schedule is busy but also balanced at the same time really helps me set boundaries.
That's
where I
good,
would
yeah.
work on what, and going to conferences is like a small break that I can have, and then meet friends and connect with them.
For sure, for sure. And what is one quality that you think is the most important to have as a dentist?
I think the main quality that any dentist should have is to care about the patient, because clinical skills is important, but you can develop it with experience and time. But at the end of the day, we're giving a service to patients, so we really have to care about their health, be there to help them, and not to see it as a business.
For sure. So like the soft skill is very important.
Exactly, and this is something that AI will never be able to replace. So don't worry about this.
Got it. Would you ever want to own your own practice?
I think I gave up on that idea just because I really enjoy how everything is right now. And when you own a practice, it becomes your baby. So anything that something happen, or anytime that something happens, you have to be there, you have to fix it. So I think my time is better well spent, teaching and lecturing and seeing patients, but not owning a practice.
For sure, I understand. And what is the most common dental advice that you give to your patients?
I tell them all the time, if you brush and floss every day, you don't need to come to the dentist. But unfortunately, it's not the case. So that's why they have caries, they have
sure.
recession, periodontal disease.
Got it, got it. And what is something that a mentor or another specialist has told you and that has stuck with you all these years?
So Dr. Simon Tran is he's a professor here, and he's a very big mentor to me. And the thing that he keeps telling me is always keep it simple, stupid. And that's what I try to do. I try to keep it simple.
Got it. So we're almost done. A couple more questions. If you didn't do dentistry, what other career path would you have liked?
That's a very good question. I think that if I didn't do dentistry, I would still be doing research, just because I like the fact that you're discovering new things, creating new techniques, and that can have an impact on the way people practice. So either a researcher or maybe a journalist. I really enjoy writing, or maybe an archaeologist. There's so many
Ooh,
options.
that's so interesting. And then if you could change anything, and I mean anything about dental healthcare right now, what would it be?
I think access to healthcare is really important. There should be a way that, sometimes people don't have enough money and they have infection in their mouth and like, oh, I can't do anything. I have to, live like this. I really think that there should be a minimal, universal dental health care, so everybody can have access to basic dental treatments.
For sure, I agree with that. What do you foresee as the changes in the field of dentistry in the next few years?
I think technology will take a bigger and bigger role. When I was a dental student, we still had like regular radiograph, paper charts, and this was like maybe 10, 12 years ago. And in the last 12 years, technology came out like with lasers, Serect. Everybody has digital charts, digital X-rays, and we're talking about CBCT being more popular, 3D printer, intraoral scanner. So I think more and more we're seeing this digital revolution without talking about AI and robotics. So I think technology will become more and more present in dentistry.
For sure. So dentistry just becoming more high tech.
We'll all become like a robot, like manipulating.
Oh, that would be so hilarious. So what is your goal in the next 10 years?
So the next 10 years, I'm working toward creating a periodontal program, a residency here at McGill University.
Oh, wow.
I would like to become associate professor in the next few years, and possibly dean someday in my career.
For sure. I wish you the best of luck for that.
Thank you.
So the two last question, what advice would you give to pre-dental students out there trying to apply into dental school?
Um, you need to know what you're getting into, so get all the shadowing opportunity that you can. Talk to your dentist, try to observe, talk to dental students to see, how they enjoy dental school. And, just prepare yourself so you know what you're getting into.
For sure, for sure. And then now, what advice would you give to aspiring dental students who are trying to apply to periodontology, periodontics?
Yeah, you can say both, periodontology or periodontics.
I wasn't sure.
I've been a professor of periodontology, and I've also been a professor of periodontics. So they're equal. What advice I can give them is, again, to know what they're getting into, because they have to be sure. Dental students usually have minimal exposures to most of the things in dentistry. So how can you be sure that you love something so much to spend the rest of your career doing it? Of course, some students do. They have an idea very early on. They spend time doing research and internships, and you can see them in the way they answer questions. But other people like myself, I wasn't sure what I wanted to do. When I was in dental school, I just wanted to graduate and then, go with the flow. But I'm happy that I end up, somewhere that I feel a lot of joy going to work every day. I never feel tired. So maybe the best advice is, step outside of your comfort zone, try to discover and touch everything to discover what you enjoy. And once you have it, then, apply for it and try to get into
For
Perio.
sure. That's a very good advice. So now that's pretty much it for the 52 questions. I
All
just
right.
have a bit more questions, like bonus rapid fire questions. Are you ready for that?
Yeah, let's do it.
All right. So dog or cat?
Doug,
Pineapple on pizza? Yes or no?
definitely.
City life or country life?
City life.
If you could have dinner with anyone in history, who would it be?
Oh, anyone in history? Benjamin Franklin.
Ooh. Favorite color?
Blue.
Which country have you always wanted to visit?
I've always wanted to visit Japan, but I've been recently. I think the other one, Easter Island would be one.
Ooh. And favorite dish to eat?
Pho or sushi.
Name one thing that is on your bucket list.
Visit Easter Island.
What is your go-to song to lighten your mood?
Oh, go-to song. I like anime soundtrack.
Okay. And are you, well, last question, and I think it's the most important questions. Are you happy?
Of course, I love what I'm doing.
For sure. All right. Thank you
All
so
right.
much, Dr. Nguyen.
Well, thank you for coming.
And I'll see you next time.
Of course.
All right. Bye. Take
Bye.
care.